And you've probably been hearing about outbreaks of a parasite making people sick popping up across the U.S. There is a lot of chatter and concern about this, but there also are ways that you can protect yourself. AB's 10's Beck Hotbegger spoke with an infectious disease specialist and joins us this evening.
Alex, let's start with the good news, okay? The California Department of Public Health says California is not one of the states currently experiencing an increase in cases of cyclosporiasis. Now, that's an intestinal illness caused by the microscopic Cyclospora parasite. In fact, California has only seen 40 cases statewide this year, and that's down by half from this time last year. Still, there are ways to keep ourselves safe.
People who have Cyclospora infection have gastrointestinal illness, and that's primarily manifested through diarrhea, watery diarrhea that can be explosive. And this is associated with other symptoms such as nausea, bloating, and cramps. It usually is not associated with fever or vomiting, and that differentiates it from other causes of gastrointestinal illness.
Dr. Dean Blumberg is professor and chief of pediatric infectious diseases at UC Davis Health. While uncomfortable, he says the illness is not usually life-threatening and is treatable with antibiotics. He says unlike other gastrointestinal illnesses like E. coli infection or food poisoning, cyclosporiasis takes a while for symptoms to develop.
The average time between getting exposed to the organism and then having symptoms is about a week, but it can be up to 2 weeks.
He says that's a big reason why health officials elsewhere in the U.S. where cyclosporiasis is spreading are having trouble pinpointing the exact source of contamination.
When you're investigating an outbreak, what you would do is you would interview people and say, tell me what you ate the week or two before you first had symptoms. And many people can't remember specifically what they ate. And then even if they do remember, then to go back and try to test those foods, if they're fresh foods, they may not be available, so you may not be able to confirm the source.
He says cyclosporiasis is generally not spread person to person.
It's spread via contaminated food.
Nationwide, the CDC has confirmed more than 1,600 cases across more than 30 states since the start of May and is aware of more than 5,000 additional cases that await further analysis. Specifically, the CDC is identifying a multi-state outbreak linked to Michigan, Ohio, West Virginia, and Kentucky. In Michigan, public health officials say early information points to lettuce or salad greens as a possible culprit. On Tuesday, the Taco Bell restaurant chain issued a statement saying it had voluntarily and temporarily removed limited ingredients at select restaurants as a precautionary measure.
If they can identify exactly what's causing this and exactly what products, and then recall those, then I think we'd have a lot more confidence.
Dr. Blumberg says fresh fruits and vegetables are part of a healthy diet, and since there's not an outbreak in California, he still recommends people eat them. But it's always good to take precautions.
Washing fresh fruits and vegetable under cold running water is appropriate. It may not totally eliminate any contamination, but it reduces the contamination, and that reduces risk of infection.
Now, Dr. Blumberg said people with mild cases can usually just manage symptoms at home, and the body's immune system will eventually kill off the cyclospora. But if symptoms are lasting more than 3 or 4 days and it's interrupting your life, he says that's a good time to go to your primary doctor. Again, California health officials say only 40 cases have been identified here so far this year. That's lower than last year at this point, and they say we are not seeing an outbreak at this time.